Hello, good morning, LinkedIn. Claire Henson-Bowen here, founder of Bespoke Wellbeing. And today we're going to be talking to you about the differences between telehealth and virtual care, and also how you can use it to reduce sickness absence. So my name is Claire. I'm the founder of Bespoke Wellbeing, which is a occupational health physiotherapy company. And I'm joined here by Colette. Colette, do you want to just introduce yourself?
Yes, hi, hello, my name's Colette Owen. I'm the clinical director of Bespoke Wellbeing and have been a physiotherapist for, over 20 years now, in a variety of roles. And yeah, that's me.
Thank you very much. So we would just like to say that today we want it to be interactive. So if you are watching or you're watching on the replay and you have any thoughts or questions about what we're saying, please drop them into the comments below and we'll come to any questions at the end. So today, Colette and I wanted to come on and discuss the differences really and explaining what telehealth is and what virtual care is, because although telehealth is a new concept, and in the space of physiotherapy, it has become sort of into the limelight, hasn't it, Colette, since COVID came along. And all the physiotherapists were told to do a virtual first approach, and we were all sort of slung into telehealth and virtual care. And as time has continued, particularly in the occupational health space, virtual and telehealth care has continued into this sort of hybrid, blended approach of managing employees to keep them fit for work. So looking at providing telehealth virtual care alongside face-to-face provision. So we want to just come on today and talk a bit about what those mean, what telehealth means and what virtual healthcare means, because we still think there is a bit of confusion, isn't there, Colette? And I think when we started, although we knew we were doing video consultations, we were like, is it called remote physiotherapy? Do you remember? Is it called virtual physiotherapy? Is it online physiotherapy? Do people realise it's live? Do they think it's like an app? Like, what's going on? So we've had a lot of learning along the way. So we want to jump on and just kind of go through that. So I'm going to fire questions at Colette this morning. So Colette, can you just explain what the differences are between sort of telehealth, so sort of telephonic care, and videos of virtual care for me?
Yeah, okay. So telehealth, so where an assessment is completed over the phone, has been around for a few years, and it's been trialled in many different ways within the UK and across the world, and it's been used in many different forms of healthcare, so A&E, physio, lots of different ways. And it is literally a phone call. So you will phone your patient, or your patient will phone you, and you have a conversation. A lot of the time it's linked with an algorithm. Okay, so, yes, no, this takes you down this path, this takes you down this path, or it can just be more freeform. So using the clinician's, experience of the questioning. It's usually a very short phone call. Okay, it can often be about 5-10 minutes long, and it's very often used for a triage purpose. So by that, it's where does this person go next? Or if we think about physiotherapy, are they suitable for physiotherapy and will continue? If so, what kind of physiotherapy? Or are they not suitable for physiotherapy? Or do I need to refer them somewhere else? It might be for further investigations or to another speciality. So it's very often used as triage. There may be cases where it's also used as a checking in process. So, you have an established relationship, so it might be for more longer term conditions, and you're using that telephone call to check in, how are you, It can be quite successful, but sometimes it doesn't work for a number of reasons, which we're going to talk about. But then if we think about video or remote or video health, or whatever we want to call it today, again, this can often be done in a number of ways. As you said, it can still have that automated approach, that algorithm approach, or bot approach. So there's some set questions, set answers, and it takes you in different ways. We know from talking to patients and clients and other physios that even in a physio assessment, it's being used in different ways. The way we use it at Bespoke, it's real time, very much like this. You're having a real time conversation with the person, but also you're doing pretty much a full assessment. So not only the subjective talking bit, but actually getting that person to move around, completing tests. Whereas I know that some of the practices might just be doing the talking bit, going straight to treatment without doing a physical assessment in between. So even that in itself has many different ways in how it's being utilised. So in Australia, for example, the Telehealth, this real-time video, is pretty well established, mainly because of the geography of Australia. Your nearest clinic may be literally hundreds of miles away. So actually it works really, really well, and it's very well established and pretty much a normal side of physiotherapy management. So those are the main differences. Telehealth is most likely going to be a phone conversation, whereas video health or remote physiotherapy or virtual physiotherapy could mean a phone call, but in how we're practicing it is by video.
And there are obviously some clear advantages of doing telehealth or virtual care. What would you say are the main, if you're comparing that to, say, face-to-face provision, what would you say the key things that you've sort of found?
Yeah, so if we're comparing it against face-to-face, I think, phone or video, I suppose the most obvious one from an operational point of view is cost. It's far cheaper to do a video or phone call because you've got minimal overheads. You're not having to hire a clinical space. You may be having to pay out for the secure phone line or secure video link, but from a cost effectiveness point of view, it's a lot cheaper to run. I think and with that comes the ease of use as well. It's really, really easy to set up an appointment for video or phone call, and that person is agreed. So it's very much that same patient agreed appointment times, and often it's quicker as well. Quicker access because there's no travel involved. It's you can see more people because your diary is more streamlined because you're not in a clinic, having to put in other ways. So those are probably the two main things. So the cost effectiveness point of view from an actual provider, but also the ease and quickness of actually getting an appointment as well.
And we've spoken on the years, haven't we, about, it's kind of my own opinion is around patient empowerment, and that kind of when they get better from a telehealth virtual consultation, they've got better because they listened, they took on board the advice, they've done their exercises, they've done it themselves, they become much more body aware, don't they? And so when they come back on their reviews, they go, oh, I'm feeling loads better, or I'm able to do this now which I couldn't do before, I've gone back to work. It's like, yeah, pat on the back, like you did that yourself, like they did it all themselves. That empowerment, I think personally, has been huge, and that early reassurance, that early intervention, compared to sometimes in clinic and face to face where you see people and they can become quite passive, can't they, and sort of reliant on coming in, lying on the physio couch, having a massage, and they come back and say, oh, I haven't really done my exercises, I was a bit better after you saw me, but it sort of crept back up again. And you say, well, have you done your exercises? No, I haven't. So they can become quite reliant, I think, on those sort of interventions. So it's trying to get them to become more empowered and more self-managing things with exercise and advice.
I agree. I think that's probably been one of the most standout experiences from this, which we weren't expecting, of gosh, this has really changed that physician client relationship, in the fact that, as you rightly say, they've become more empowered because they're in their own home. We're in our own home or wherever we may be, so you haven't got that clinical setting which immediately just changes the whole relationship. But also they're being shown things, even just the assessment itself, can you do this yourself, how does it feel, so they're getting more involved in how their symptoms present and what they can and cannot actually do. But then actually when we're doing the interventions and we're doing, whether it be an exercise or a self mob, they're doing it themselves in their own office or in their own home, so they know they can do it. It's like, oh, okay. So that they haven't, as you say, it immediately gives them that control and the ability to do it, and knowing that they can do it. So actually, I do feel that the patient compliance has massively improved. But as you say, that mindset as well of, oh, actually, I can manage this myself. I don't have to take that passive patient role.
Which is the dream, isn't it? You want them to be
Yeah. And even though, when we were, in clinics, we were promoting, we've always promoted that education that self-management. But as you say, it must be easier for a patient to realise that when you can't do traditional hands-on, because they have just got to do it themselves.
Got to get up. And we've seen as a business a lot of growth and a lot of change, haven't we, through COVID. And that initial we were very face-to-face based pre-COVID, and then quickly had to shift into video consultations. And obviously we've chatted before, haven't we, around what we do as clinicians and developing and altering our own skills at how we assess people, because it is different. You haven't got your hand there to resist test a muscle power. You've got to improvise in a way. You've got to use walls. You've got to use functional tests. There's a change in that practice. And I've heard a lot of people talk about telehealth and virtual video care. And what do you think from a clinician's perspective, so not just sort of from the patient perspective, but from a clinician's perspective, why is video easier for a clinician to assess somebody than, say, on the phone?
Yeah. The observation bit, being able to see them. I think that's, if I think back to initial days being at university and the physiotherapy degree, one of the first things you were taught was listen, and two, look at your patient. How do they look? Do they look well? Do they not look well? Do they look in pain? Do they not look in pain? And actually just being able to see the person just tells you so much. Even just the way that they're sitting, the way that they can move around. I think when you look at research comparing telehealth and phone health and face-to-face, it would have been then, it is that interaction of just being able to see the patient can tell you so many clues before you even start asking questions. And then obviously a lot of our tests involve movement and varieties on that, so actually being able to see the movement is massive. You can obviously see lots of movement pattern changes, or again looking at how they do it, but then also I think what's been the great thing is getting them to then do some things. And so how does it feel when you're doing overpressure? Have you got a soft end feel? Is it a bit stiff? Is it it's painful? Is it blocky? What does it feel like? And again, it's always listening to the patient. They know their symptoms best. And you're able to get so much.
I was just going to say, we have picked up some sort of mental health crises as well, haven't we, on the virtual side of things? And I think with some of the times I've had, certainly, I don't know if I would have caught that on the telephone. So just like you're saying, the observation, they're very slumped, they're not maintaining eye contact. We've observed some things that were worrying. So that all that input is just so important, isn't it?
Yeah, no, definitely. And I think, it's trying to create a relaxed environment. I think that's the other thing, we take time with our assessments. We're not trying to rush through. Sometimes with telehealth, because, they are often stacked together, there is that sense of rushing. And again, we're not following an algorithm either. So we are using our own clinical reasoning. So again, you are able to go off, as you say, not on a tangent, but just follow a line of questioning because you've noticed something, whereas on a phone you might not be able to do that anyway. It is those subtle, non-verbal communications which are so powerful and which we can do on video.
We're trying to replicate as much as possible a face-to-face consultation, aren't we? Bar not putting your hands on somebody, we're doing everything the same. So take them time. And we, with our long COVID program, we find, don't we, that they need to talk. They need to tell their long COVID story, their COVID story, and they need that time, not be rushed through. Okay, cool. So my husband still sits, watches me go in my office, and when I come out, he's like, "What are you still doing? Like, what do you do in there with a virtual consultation?" So could you just, and he's my husband, I keep telling him and he keeps forgetting. Just outline, like, if someone was referred for a virtual appointment, what would be, we can use ours as an example, what would be the typical, how would they be booked in? Like, what would happen? What does it look like to somebody?
What does it look like? Sure. Yeah. Okay. We've tried to make it as simple as possible. And as you say, when we first did this, we were looking at various different platforms. So I think it's important to say, the first thing is that it's secure, it's cyber, safe, or as cyber safe as we can make it. So we do use the Clinico video platform, which works so well. It's just a link they have to click. They don't need to download anything. It is literally just you press this and one of us appears like magic, and it's really, really easy, and it can be used on laptop, phone, tablet. So again, it's just so simple. So that's the first thing, and everything is embedded. So we don't need to plan anything. They don't need to plan anything. They just book in, and it's all automated. The email link, all done. And then, as you say, we do it like a normal face-to-face session. We do our normal patient identification checks. We obviously introduce who we are and the purpose of today's session, and then we get started. So, this is what I understand. Tell me about your history. Tell me about your story. Why we're here today. And then we just literally go through it. So we start off with the talking bit, so asking lots of questions and answers, which formulates our clinical picture, and then we're using our objective, our movement bits to try and confirm that as much as possible. And as we say, I don't. Even the hands-on techniques, we've been able to modify an awful lot of them. And then, that can always be really useful, because then that can, even be a treatment technique as well for them. So there's not many things we've not been able to do. But, if someone needs to be referred on, it's usually pretty clear that they need to be referred on. But we'll always, it's like anything, we're always reassessing. So either in follow-ups, we're reassessing as you would do in a face-to-face session. We're looking at those patterns. Is this person getting better as I would expect, or is there something here which isn't quite, as I would expect? So it's exactly the same as a face-to-face, except there may be some treatments we're not doing, but there's certainly a lot more that we are, and which actually patients are responding to really nicely.
And you mentioned there about it becomes quite apparent if you need to refer them on, because we can't be naive. We can't be like, oh, virtual does absolutely everything, and we've done a lot of data extraction from the patients that we've seen. So when would it not be appropriate? What examples could you share with people where maybe virtual care, maybe the assessment or later down the line is actually decided that's not the right thing? What kind of examples would that happen in?
I suppose from if someone's presenting with neurological symptoms, pins, needles, numbness, we can still do power, sensation. We can't do reflexes. Okay, there's no way. I haven't worked out a way to do it. But we're using their subjective assessment, so we're getting an awful lot of information from that. They're able to do sensation on themselves, and they're able to do power on themselves. So we've got an awful lot of information. But sometimes you do need those reflexes to be done. So that's one where you may think, actually, from their subjective, from how they're presenting, I think it might be pragmatic and prudent for them to see somebody face to face to do a more fuller neuro assessment. So that's one. But we're still able to get an awful lot of information without doing a reflex. And then the second group are the highly irritables. So by that, I mean their symptoms are highly irritable. It doesn't take much for them to settle down. But again, I think that's very much on how they present. I saw a lady just yesterday, actually, with really acute low back pain. I think we're talking about like day 3, day 4, virtually via video. And, they are irritable. But there's some positions which they've already identified that they're not so irritable. So it's like, okay, let's use those and let's go on from there. So actually, I think they will respond very well. But we have had others who have not been able to find that, or we've not been able to find that within some sessions. And so sometimes you think, okay, actually, some hands-on or some alternative, like acupuncture or something hands-on may be, more appropriate for this person. So those are probably the main two. If they need a more fuller neurological assessment, or if they're just really highly irritable and we're not able to find anything within those sessions to to minimize that.
And just for those that don't know what irritable means, so you mean sort of high pain scores out of 10, 10 being the worst, 0 being no pain, don't
so it doesn't take much for them to bring on their pain, and when it does, it's really, really high.
That's it. Perfect. Thank you. And of course, we still have the normal category of patients, a small category that maybe need investigations or injections, don't we? That's obviously different to a face-to-face assessment. You may find people that are still in that catchment.
Yeah. And I think that's no, when we have done our data analysis and our audits and all of that, again, it's been really interesting to see that the figures really have been no different to face-to-face. There is always a small percentage of people, even though physiotherapy has perhaps taken them 80-90% there, they sometimes feel that they would benefit from an onward referral for something else. So again, I which I'm actually hoping to see some surgery in December. There's again a runner I saw quite a few months ago. I'm pretty sure it's for their knee. I can't actually remember so much, but we did really, really well. But they had really bad bilateral bunions. Okay, and actually that was causing problems elsewhere. So although we got them an awful lot better, we kind of knew once they started to increase their running again, it was just going to come back. So it's like, do you want to see someone? It might be useful just to get their opinion about what they think. So that's what we were able to do. We were able to, present them to an orthopedic foot consultant, and actually they are going to have a bunionectomy, which is going to be quite interesting. But sometimes you've got to refer them on a bit sooner than that. Sometimes it's really obvious. Sometimes it's because physio isn't quite taking them all the way there. But that's no different to face-to-face.
No different. It's the same little catchment people.
It's exactly. Yeah.
Perfect. And last kind of question for me around reducing sickness absence. So obviously that's what we're all about. We referrals from occupational health employers, case managers, to help people get back to work. So how do you see virtual physiotherapy helping people get back to work? How does it reduce that sickness absence and keep people in work?
Gosh, I think building on what we said at the very beginning, the absolute ease of how we can arrange these appointments, or for the ease of that person in actually seeing a physiotherapist. It's so easy. So, if somebody is off work for whatever reason it may be, they may not actually be physically able to get to a clinic for whatever reason. So the fact that you can provide a virtual real-time video consultation means that they are, and it's flexible around their times as well. So I think that ease and rapid access to physiotherapy, there's so much evidence to show that the sooner you get seen, the far better it is in the short and long term regarding return to work and getting better. So that in itself, the absolute ease. We provide a really, really excellent service as our patient satisfaction tells us, and our outcome measures tell us as well. And so with that as well, if you're having virtual real-time video consultations, you should know that the actual service you're getting and the quality of physio you're getting is still of a very high standard. So that in itself should be another thing. And as we again spoke about, it's about that empowerment. People don't need to be 100% better to start that return to work process. So actually empowering that person in self-managing their condition, or even getting their condition better through the things they can do. A lot of what we do, because it is based at home, they'll often have minimal to no equipment, they can easily do in the workplace as well. So a lot of what we do is easily transferable between different situations. And often if they do need equipment, it's really, really simple. We're talking about a bit of resistance exercise band here. We're not talking about anything whiz bang at all. So again, it's all easily accessible and easily transferable. And a lot of what we do, as you say, is function based. So again, it's always related to something, or we can transfer it across. So again, we have really good positive results from that.
Perfect. Thank you so much. I like to do a little question at the end. So I'm just thinking about, because we do patient satisfaction, don't we? Can you think top of your head, any kind of feedback that patients have given us? So I know we sort of post them out occasionally onto here as sort of testimonials, but can you think of any kind of comments from patients? Because some of them are a bit unsure. They are. We can't deny, can we? They're a bit like, how does that work? So what kind of feedback, if you can think of any?
Yeah, I mean, okay, so we had somebody who had long-lasting pain following a car accident. They'd been through lots of different physio, face-to-face physio, lots of different things. We started to see them virtually, and they were, pretty skeptical about, is physio going to work? And I don't think it was just the fact that it was virtual. I think it was the approach we took as well. And, they were just like, this is amazing. This is absolutely amazing. And actually said, if I was seeing somebody face to face, I would be reliant on the fact that they would be doing something for me. But, you guys have taught me things that I can do for me. And actually it being virtual hasn't really changed that at all. I've still been able to do things, and they've made a massive, massive improvement. And I think a lot of that was actually just that empowerment of, the right interventions for them at that time, but actually the fact that they were able to do it with relative ease, just things around their house. But yeah, they were just absolutely thrilled by how well it worked. We're doing some virtual clinics at the moment for a London-based company, and we're doing some little exercise webinars for them as well. And I did one this week, and obviously we've got the chat function on the side. And I just noted that, because I always say, please book into the clinics. And one of the on the chat was, I can 100% recommend the appointments. Smiling emoji. And again, I think that's been great. And this is somebody who is at work, but who has some symptoms which actually they want to get sorted out, which we've been able to do, and they're absolutely loving it, and they love the fact that it's virtual, because it's so easy to do within their work day. And I think I've seen this person within the office environment, but also at home, and it just works. If we're thinking about long COVID, again, it's worked incredibly well. I mean, we do a lot of safety netting. That's a conversation for another day. But actually, when our brilliant admin team are contacting patients, they're all saying, we are so grateful that this is online and virtual, because we're so tired. We don't want to go out. We don't want to go to a hospital. We don't want to get another infection. This is just brilliant that we're able to do this from our house, and it's real time. And we'll be getting just the same quality. So I think there's lots of different benefits, and I think also we're seeing from acute to very, very chronic to something very, very new, and video has been able to allow us to do all of that and get good outcomes from all of that as well.
Brilliant, thank you. And one of my big values and kind of visions really is that I want any size of employer to be able to access occupational health physiotherapy. I think people, they put their head in the sand, they think, oh no, we can't afford to provide that for anybody, or that they maybe don't look at it as an option. But we want to kind of make sure that we are flexible, don't we? And our packages are there for ad hoc referrals, or for larger organisations we have different packages available to make it more cost effective. So I guess my ask is, if anyone is watching and they're thinking, well, actually we do have someone that maybe could benefit from this, is just to contact us, isn't it, Claire? We're very happy to have a chat and to kind of run through the types of things that you can access and price stuff. But it's not as scary as people think it is, and
it's so easy to do a demo as well. So again, if people want a demo of how it actually works, we can send out a mock appointment email, press the link, do a little see how easy it is. So yeah, it works so incredibly well, and we get really, really good feedback. People really enjoy the ease of access and actually the high quality physio interventions that they're getting, and obviously that that is then shown in the great outcomes we're getting as well.
Great, thank you ever so much, Colette. I think that's everything. Is there any more comments from you, Colette, or are you happy I've quizzed you enough?
Yes, don't throw any more curveball questions at me.
Well, thank thank you very much for listening. If you have any further comments or questions, do put them in the comments below and we'll come back in later and answer them for you. Thank you very much. Bye.
Bye.